This is part 2. Okay. So we're back again. We're going to talk about shaping the mask on a patient, and Reggie has some other topics to mention. One thing also to look for troubleshooting, if the alarm is going off, you check your tubes, you check this guy, the mask is sealed properly. You also want to check for backup water flow.
Yes. Yeah, so you may not get an alarm for that. So basically, what I thought about after was, so with the heater, so we have 2 settings. You have on this side, you have like a face with a endotracheal tube in it, and then you have a face down here that's clearly wearing a mask. I don't know how well you can see that. This is for people who are basically on a ventilator, right? And then the non-invasive, which is spelled here, you got non-invasive and invasive. So anyone on a BiPAP mask, or just a BiPAP in general, should be on the bottom one, non-invasive. And to change that, you just push and hold until it beeps. So the difference is non-invasive mode is going to be 31 degrees Celsius and invasive is 37. If you see this on this mode, if it's on invasive and they're not intubated, which no one on this is going to be, the rain out that you get from that is extraordinary. This portion of the tubing, all of this will be completely, like literally flooded with water, and you will see massive droplets everywhere. And I've also seen it to where it will get so bad that water will pool like at the bottom of the mask here, like in this portion. And the patient obviously
Huge aspiration.
absolutely be aspirating that, right? Mm-hmm. And patients will complain. Some patients don't want heat on these at all. A lot of it is people who've worn them at home or often enough. They have preferences. Some don't want anything, but usually most, I would say like 8 out of 10 patients are fairly happy with the non-invasive mode. You can get a little rain out even in the non-invasive mode, depending on how, if it's like too tight. But I usually don't. I've never seen an actual rain out problem on 31. So how in the world do we get to be wearing a BiPAP and it's on 37? How does that happen? So the main reason that this happens is, let's say the patient was done wearing it for the day. And you shut it, you put it in standby mode. Obviously you want to shut the alarm off, or the heater off. So now the patient has distress out of nowhere. Oh no, patient, they can't breathe, we got to put the BiPAP back on. So we scramble, we put the BiPAP on, and then we just flick the heater on, and we don't think about it, and we walk away. Mm-hmm. The heater's on, the BiPAP's on, we're good to go. The issue with that is the default temperature is 37. So if you don't make a point to put it in non-invasive every single time you turn it back on, it's not going to go into non-invasive. It will stay on that 37, and that's where your rain out and your issues with that will occur.
I did not know that.
So always make sure default temperature is always 37 every single time. And then obviously when the patient's not using it, please shut it off. That's the number one way that it gets on 37.
Also, we're going to show how to fit a mask properly on a patient. Reggie's going to be our team player here, and he's going to represent a patient.
If your patient tells you that they feel like they're suffocating, or they just hate it and it's very uncomfortable, believe them. It's pretty tough to use. It's okay once you get used to it. So if you ever hear me or another RT say something like, it feels weird at first, just don't fight it and let it breathe with you, that does work. Like that truly is an accurate thing to say. But if they're already freaking out, if they're scared, they're already anxious and they can't breathe, it's a lot for them to deal with, obviously. So I'll put it on and I'll try it. It's hard to even talk with it. So when the patients can't talk, that's mainly the EPAP setting. Because remember, that's the pressure that we're breathing out against, so exhaling becomes more difficult. So I will put it on, and then...
And just to make clear, it's in the standby setting, and once to put it back on the patient, we can just put it back on, and it should restart itself.
It needs to have it'll sense the seal, so when it senses a good seal, it should fire
Don't fight it. Okay, so now we have a successful Bipap. Reggie's breathing much better with the Bipap now. You can see his rate. And you're also looking at this patient leak. It looks like it's a good seal. Now, if the mask were not fitted properly, and say we adjusted this and now this is leaking, you'll see the patient leak will go up tremendously. And that's how you know you have an issue. So you want to have, I always have the patient hold the mask themselves. Reggie, will you hold your mask in a place that's comfortable? And then while they're holding, this is just Velcro. All you have to do is kind of adjust the strap so it can hold it in that spot for them. Okay, let go, let's see. And we have our mask leak fixed and it's back down to 10.
Once you get the Velcro adjusted appropriately, you shouldn't have to readjust that. Oh yeah, you can just clip, so just pop the clips here, and they just kind of slides into place, and hear the audible click, and you're good to go. You should not have to mess with this unless it needs adjustment. This is, try not to touch this part, but you also have, this is the nose, oh yeah, all right, hold on. You have a nose adjustment here. Let me show you. So obviously skin breakdown is a problem with these, right? Like on the bridge of the nose. So you can kind of combat that just with the way it's set up. This part will push it tighter on the nose. It'll push it tighter on the nose, but then it kind of brings it up from the bottom. It kind of like teeter-totters or whatever. So you can, so the good part about that is you can get a better seal with just the Velcro without having to squish it on their nose with this.
So would that be something you do if the patient says they're feeling the air in their eyes? You would go for the nose adjustment.
And it does it so that way you don't have to like wrench the straps down. So you have two adjustments for the nose. So you can either keep it loose, like if you get a good seal, you can have it loose up here, have it in a more downward fashion, right? And then you can just adjust the straps, or vice versa. It just depends on the patient's face, or facial hair. But I can feel it leaking up here. What if I? Now it's gone.
Beautiful.
Yeah. And one more thing. Your leak, you don't really ever want your leak at 0. So typically, I'm sure you could find, opposition research to this or someone's opinion, but typically I like to shoot for a leak in between like 10 to 30, give or take, because the patient exhales out of this port, as I told you earlier. They exhale out of there, but they also need to exhale a little bit out of the mask too. It's not supposed to be a perfect tight seal, because remember, it's not a ventilator. It does not exhale for you through a separate limb like a ventilator does. So the mask does not need to be wrenched down, breaking the skin down and then having CO2 sit in there. So a leak anywhere from 10 to 30-ish is perfectly acceptable, honestly, and the machine can compensate for even higher, but if it's above 30, I'd probably want to address that.